Welcome to my podcast, The Lower Down Experience. Many of you will know me from my Instagram page at Fabulous Pharmacist, where I love to shine a light on topics that people normally shy away from. Today I spoke with Dr Fionnula McHale. Fionnula is a functional health medical doctor. Today we discuss functional medicine, nutrition, health, exercise, weightlifting and mental health. Please note that there are references to child abuse and suicide throughout this podcast. To support the Lower Down Experience, please check out my sponsors in the podcast notes below. Enjoy the show. So you got a taxi here today, Fionnula?
I did.
Why is that?
Because I actually never learned to drive.
Why not?
Look, I suppose I moved to Dublin when I was quite young to go to college, and there was never really any major need. So there's that. But also, I suppose, over the years of being young and growing up in an environment whereby there was people driving a car drunk, things did happen. So I don't know, it always put the fear into me of driving in crashes and terrifying things happening in the car. So I always, I don't mind other people driving. But I just never really... It was never something that I ever wanted to go down. Now, look, at the last number of months and during lockdown, I've kind of got better at, I need to learn this driving. But I still can't say that I'm mad to do it. Now, look, I suppose the climate is different as well, in the sense of I think we have a great transport network in Dublin. There's no major need for it. Now, a lot of other people will think it's mad that I get DART or I get the bus or I get taxis, but
it just takes longer to get everywhere. That's it. But you just need to kind of plan out your day properly, I suppose.
Yeah, but I walk a lot too, and I quite like walking. Is good for me and everything else. So
yeah. So were you, when you were younger, you were in cars with people that were drink driving and just you were in accidents or it was scary situations?
It never came to accidents as such, but there were definitely some near misses, and it's only for the fact that my brothers are mad into cars that if things happened they could maybe do what they needed to do to get the car home but like I said, they're younger than me too so but one of my brothers he's mad into cars, so he knew how to do the bits and pieces without going into too much detail but I suppose that's probably part of it
Goodness. And how did you get into functional medicine? Because I know that obviously you're a qualified doctor, and what made you go down the route of functional medicine as opposed to even just normal GP or...
I suppose initially I was going to go into orthopedics. So the way I would have with my education in younger years, I loved science. I loved the molecular element. I loved the biochemistry. I really loved that side of things. And so as you get those points in medicine, you just, you get those points in the leaving cert, it's kind of just assumed you're going to do medicine, because
I know it's kind of like that route, isn't it, that people do if they get the high points. It's not necessarily the best way to go either.
No, and it's not. And that's what I've looked back in recent years. I would have my second choice would have been veterinary, and then it would have been drama. You know what I mean? And you wonder how
I wanted to be an actress too. I think I put down drama in Trinity.
Yes,
I wanted. Yeah, it's mad, isn't it?
But you wonder how much different life would have been if you'd gone either of those routes. And in recent years, I have looked into going back to do veterinary. Anyway, so how the conversation, I suppose, is how I got into functional medicine. So like I said, very molecular based. I was very good at the biochemistry, your Krebs cycle, glycolysis, it came like that. All that sort of, and even the pharmacology, all those mechanistic type stuff that, for some people they find it hard to conceptualize. That always came very easy. And I suppose I went into medicine on one hand, waiting for this challenge, okay, give me all of this molecular stuff, and I'm thinking, look, even in one cell of the body, there's so many of these different intermediate metabolites, all these enzymes, the cofactors, and I'm thinking, wow, I'm going to be dealing with all these patients that have a wide variety of different issues. Some people different people have different issues, and one person may have multiple different issues. So I'm thinking, oh, this is going to be amazing. Like, you know, I was just so excited to learn this stuff. And look,
one week in, you're bitterly disappointed.
Yeah, now to be fair, I didn't do first year. Like, I got to jump until the second year.
How did you do that?
I think it was back then, if you got the points, you were able to go straight, like skip the easy year.
Skip the bullshit and go straight to it.
So that maybe the people who didn't have the Leaving Cert subjects and those the Leaving Cert hadn't done like biology or chemistry.
Oh, okay.
I think it's like a pre-med type year, is that what it's called? So anyways, there wasn't that. So I went straight into like anatomy, biochemistry and physiology. And I love those years. Now I probably like just moved away from home, moved away from all the stress I've been dealing with my whole life, and probably did go a little bit too crazy on the partying side of things.
I went totally nuts in first year.
Yeah, like, there's no denying that. Like, and even people will say to me now, they're like, geez, remember you in first year, Fionnula, you were like mad to go out. Like, oh yeah, Jesus. But yeah, so anyways, like the first year is fine. Like, there's a little bit of physiology, biochemistry, and then I kind of got into the latter clinical years, and I found that really disappointing, to be honest with you. Like I said, some people, they love it and they love being in the hospital, they love all that sort of stuff. But I really found it hard to engage purely because I was like, what happened to all the science? Like, where is it gone? Like, it's like someone with depression, like you're telling me, like, if the patient has depression, we like tick off these symptoms here and we put them into this category of depression. And then we go to a list of medications, and number one doesn't work, I go to number two. Number two doesn't work, maybe I change the dose of number one, or maybe I just combine. But there's like, okay, like, you know, I found that really difficult. And look, I know psychiatry is a different area and probably has come a long way now, but...
Well, it's grossly underfunded anyway. We know that I'll have a psychiatrist on in a few weeks' time, and what he's been saying is unreal. You know, we know that anyway, but I don't think that the answer to a lot of psychiatric issues is necessarily the way that we're doing it now, in terms of, like, certainly depression, like, it's like a one size fits all, you know, give someone escitalopram.
Yeah, but even in that, like, look, there's a lot of like the dopaminergic or the catecholamine drugs, and like they're only seen like way down the line when somebody's already tried a load of SSRIs or SNRIs and they haven't worked. It's like, oh, last resort, maybe we go to Wellbutrin, like, but maybe we need to be able to differentiate, you know, I suppose for someone who has suffered with depression, I probably have a better grasp of the people, not through any intellectual capacity, but just purely from my own experience and having been around other people who suffer with those mental illnesses. You can kind of figure out from what the person is saying or their history or what are they into or what do they get a buzz off of. Like, do they like the high intensity exercise? Are they more of a yoga person? Like, that in itself is going to give you some insight into what does this person maybe need. Do they need serotonergic support? Do they need catecholamine support? Or, you know, is there some sort of, like, I don't have the formula just to clarify, but I suppose these are just things maybe that could benefit from a little bit more looking into, rather than just low mood, it's been there for this amount of time and no appetite, sleeps poor, sleeps too much. You know, those things are maybe...
Okay, so when someone like comes to you and if they do have depression, how do you deal with them?
Well, I suppose I don't do any like prescription. So and I suppose maybe it's worth like describing what functional medicine is before we go into that area. And I suppose functional medicine is largely about determining or attempting to determine underlying causes for disease. And I suppose you're really looking at the parameters, lifestyle parameters. Like so for example, rather than just saying, like, we keep talking about depression, but maybe IBS is a good example. So like if we look at IBS, like, you know, there's no, it's more of it is a syndrome rather than, okay, I know what's causing it and so I'm treating it that way. As these Crohn's, you know, there's an autoimmune component, you know, so it's a little bit easier, I suppose, in terms of management and easier to conceptualize. But if we look at IBS, I suppose there's a whole variety of factors that contribute to someone who has those symptoms of IBS. So for one person, it might be entirely psychiatric. You know, some people, the IBS has been generated over a number of years of trauma. Like, you know, that's well documented. You know, like the gut-brain axis, that bidirectional communication. Like, for some, the only thing they will present with is just, oh, my tummy, I'm bloating. You know, sometimes I have diarrhea, sometimes I have constipation. But unless you fully go into that history, it's hard. The patient themselves think all their problem is tummy. But, you know, if you go into the history, you see, okay, well, like they have a history of, you know, abuse in the family, the parents alcoholics or whatever has been going on for them. And oftentimes people who have experienced heavy trauma, they actually deny that they've anything really bad has happened. And again, I know that from my experience too. I had read it in the books before, but I think it was only when I went through it that I was like, oh, that actually is true. And so then the nature of functional medicine, you're asking those questions, you know, any stresses, traumas, major life events, you know, that's the start of a consultation. You know, what was the childhood experience like for you? What was your relationship like with your parents? How did you get on in school, academically, socially? You know, these things that I suppose we don't all, unless somebody asks us, we're not sitting there thinking about, oh, I wonder could something like it happened like when I was 4 years old maybe affect me now, you know? But I think the process of even asking those questions is huge, because then you start to see people, like a lot of people come back to me then after the first consult and they'd be like, God, yeah, like when I said it all out loud, like in that kind of linear timeline fashion, God, like that kind of was a lot. Like, and maybe I do need
How
therapy.
long is a consultation then? Because you could be there for hours with someone if they're going to be giving you their whole life story.
Well, yeah, and sometimes you are there.
Okay.
But I suppose it's no more than if you're going to psychiatrists. Like there has to be a time limit too.
Yeah.
And you have to be strategic in terms of asking questions. I suppose that's sort of... Like,
so it's more holistic, definitely. Like we, obviously, because like, you know, the way if you go to your doctor, there's generally a short time frame to talk. Everyone's under pressure. The system is pressurized anyway. So the short time frame, so you can't get all of that out. And generally people leave with a prescription, as opposed to potentially maybe getting to, well, trying to get to the root cause of the issue and dealing with that. Is that what functional medicine is?
Yeah, and remember GP is acute as well, as opposed to, well, like I said, the GP doesn't have time like I do. Like a minimum I see the person is usually an hour.
Okay.
And you're looking at it from a different perspective. Like someone's not going to come to me if they have like an acute infection or they've pyelonephritis or something like that and they need to go to hospital, or if they've sepsis, or if they've a broken bone. Like, there's no point coming.
Don't go to you.
No, definitely don't. Or if they're in acute phase of depression, if someone's actively suicidal, like, or they're self-harming, that's not for them to be coming to me as their first point of care. Like, you know, they need to go to a psychiatrist, like first, or a GP refer them to a psychiatrist, and then maybe I can come in once they're stabilised, like, which may well require inpatient treatment or medications or combination of both, and then functional medicine may be able to come in and say, okay, well, what things maybe can this person do to ameliorate their condition, improve their symptoms, and maybe help them get to the point whereby they can live life a little bit more fuller, minimise the side effect of the medication, and maybe one day start to wean off the medication.
Okay.
You know, or engage more fully in life. So if you look at like any mental illness, obviously, there can be issues with having motivation. So while they might not be depressed anymore, like they might be at the stage where like, I still don't really want to get up and do anything. Like I'm not actively suicidal here, but like, you know, I still don't really want to get up and exercise, and I don't really know, is there any point? And, you know, why would I bother eating food if I have this cake? It makes me feel better temporarily. Like I get my little feel good hit from that food. So like, look, this is the only thing I have in life. So why don't I do it?
Yeah.
And unless somebody, I think, explains those things to people, it's never easy. And that's what I would say to people as well, from my own personal experience, aside from being a doctor or any of that sort of stuff, is like, if someone tells you why it's important to do that and explains that it's not going to be easy at the start, you know, I mean, like you're going to have to push through some pain. It might take you a few days, it might take you a few weeks, it might take you a few months, but these are the benefits you might experience. And inevitably, once they get that one day sometimes, that gives them the confidence, oh, I actually did it. I actually got off my ass. I got up, even though I felt like shit. Well, I don't know what I'd say.
Absolutely. We don't, just speak normally. Okay. Whatever way you normally speak.
So they get up, and then that gives them day one, and they've got to run on things. So, today I ate pretty well. I didn't eat any crisps or whatever, Haribo, or donuts or whatever it is, and I went out and I went for a walk. Like sometimes, like that's a big deal for someone with depression or even anxiety. They're afraid to go out. So sometimes, like I said, explaining those things and taking the time to explain those things, I think, helps significantly for people. And they're just simple things, you know.
So what do you perform blood tests? Do you?
Yeah.
Okay, and do GPs and psychiatrists, do you work alongside then someone's primary care, and what is the reception of that primary care to you and the measures that you introduce to their patient? Do you have
mixed
Yeah.
reactions? So like it's for me anyways, if somebody comes and they're on medications, like, I explain to them they need, like, it's not for me to be manipulating your medications, so that they're aware of the difference between acute medical care versus the nature of the service that I provide. But yeah, I mean, there's different tests. So like, say if the GP is doing the bloods, that's great. I might have a look at them and interpret them as such. But in terms of the type of test that I would do, like, you might be doing things like a stool test to identify any pathogens in the gut, for example, which may disrupt the microbiome. Or we might do, like, look, the GP can do the hormone test as well, by and large. Like a lot of other functional medicine people will do things like saliva tests. Like, I don't really use that because I don't really know that it holds a lot of weight, to be honest. To each their own, as I said, but it's just not something that I would use. Nutrient testing, so organic acid testing, I think is quite valuable in a sense of it differs from like just doing a blood level of a nutrient. So you're looking at, as I said earlier, in relation to glycolysis and Krebs cycle, we're looking at what's the patient's individual need for those nutrients, as opposed to just taking a blood, seeing what's in the blood, and then comparing it to the average of the population. We see the reference range is so huge. It's not that reference range isn't valid, but that we get maybe a more accurate assessment of what the person needs from a nutrient perspective by virtue of looking at the organic acids, so those intermediate metabolites that we can test in the urine. They can do amino acid testing as well, and fatty acid testing. So that's quite.
And do you then prescribe like a diet for someone, or like what then? How do you fit in then?
Yeah, so I guess in terms of whatever comes back on the test, that would look. I can't have ever tested somebody and everything was perfect. So, like, let's say, for example, we look at this stool test and there's a parasite. Like, for most of the most common ones, blastocystis, dientomyia, like, they're going to need, like, a medication first and foremost. And even in those instances, it doesn't always work the first course. And then they have to go to, anyways, beside the point. The interventions then, I suppose, from my perspective, are going to be things like nutrition, as you said before. And even with nutrition, so many people have asked over the years, oh, what's the perfect diet? Or they will have seen that I did carnivore for a period of time and be like, oh, like this might have been like 3 or 4 years ago. They're like, oh, are you still doing the carnivore diet? I'm like, no, I'm not. And they're like, oh my God, why? I thought you thought it was so great. Like, yeah, it helps me so much at the time. And I do go back to it every so often, but it's not like I'm going to adhere to this strict diet for the rest of my life.
So carnivore is only eating meat?
Yeah, meat, fish, eggs.
Oh God. Like, I mean, I love all of them, but not only them, and you can't eat any fruits and vegetables and things like that.
Look, there's ways you can like open it up a little bit.
Okay.
But I think back then for me, like the purpose of doing it was because I was in a bad position. Nothing was working. Like, so my doctor in the States, a friend as well, like he'd said, oh, look, just try this. And I said, oh, okay, like I'll do anything. It's like, look, please, somebody help me. So okay, I'm going to do this. And
did it help?
Literally the first day I started to notice the benefits, like, and I went back to it maybe around the weekend of this week, and I already feel like, oh, this mentally, like it genuinely feels like you've taken a load of coffee and it lasts like all day long.
So when you say within a day, is that like a kind of placebo though in any way, shape or form?
No, because like even if we look at how that's going to affect from a gut perspective, even if we do a few hours of fasting, like that is going to have an impact on the microbiome pretty quickly. And like for me, look, as much as I try to vary the diet, like look, for the most of this year, I haven't been on any specific diet. Like, so yeah, I'm going to have some symptoms like bloating, tummy's not going to feel 100%. And I certainly feel that kind of brain foggy side of things as well. If I'm eating a bit of junk, like that's normal.
Yeah.
Why did I decide to go back to it this week? I have no idea. Just sometimes I just get these things. Oh, I'm going to try this now.
Okay.
But yeah, I mean, straight away, there's no tummy symptoms. You just, this mental clarity that it's very hard to describe to somebody. And also, I suppose, back when I was depressed, it took the edge off the suicidal piece, and that for me was why I kept doing it. I did it solid for 2 years, and I was like, if that just keeps that at bay, it wasn't that I wouldn't still be quite happy if I died, like, but I wasn't actively.
Did you just say you would have been quite happy if you died?
Oh yeah,
that's the way you felt at the time. I think we maybe need to delve in. You say that so,
I know, maybe
so glib. No,
nonchalantly.
it's just quite nonchalant. But obviously the reason why you've said it that way is because that's the way you felt and it's just something that you've lived with. But for someone to hear that said, so like, oh yeah, I would have preferred to die, or I would have been quite happy to die.
Yeah.
It's a little bit jarring. So I'm just wondering, can we delve a little bit more into that period in your life and how you got through it and maybe the lead up to it and because, you know, it's an unusual statement.
Yeah, fair enough. I suppose maybe I'm just so used to talking about it now at this stage, and part of me maybe has wants to normalise it too, to an extent. You know, I'm not the only person out there who would have thought like that, and I suppose therein lies the difference between like actively trying to make attempts on your own life versus it just being there all the time. And like you said, if we got hit by, so let's say if I used to be on planes, I used to travel a lot for work, and at the time, like. And this is what I find fascinating, and this is probably why I do talk about it quite openly, is because when I was in secondary school, you know, I did the mental illness debating competition, like, you know, I was doing all these speeches like about suicide and self-harm and depression. Then I was on the psychiatry debating team, like in Trinity for the intervarsities. So again, like I'm very familiar with psychiatry. Like I know what it says in the book about depression, and I know like all these things. I've seen the patients on the ward, and never for a second did it occur to me that the way my mind was abnormal. So if I didn't, given the amount of time I'm exposed to psychiatry, I'm talking about it, I'm quoting Hamlet, to be or not to be. And never in a million years did it occur to me there's anything wrong with me.
Okay.
So I had spent my whole life like that, like
depressed or suicidal, or
the suicidal feature was genuinely like my first overdose would have been like at 8 years old. Like, you know, cutting was always there, and I just thought that was normal. Like, you know, I mean,
when you say overdose, what did you try and overdose on?
I think it was aspirin or something, nothing too severe. Like, but when you think of an 8-year-old child, for me now, when I see kids that age, I'm like, now it shocks me. Back then, I just be like, look, that's just the way life was, and like I didn't have a choice. I got through it, but now I probably have a little bit more compassion for myself, I think. But the suicidal piece was always there. I spent my whole life depressed, and I don't think that has abated, quite honestly, until earlier this year. You know, that's like, I know it's probably hard for people to hear, but that is the genuine truth. Like, this is,
you know, that expression, the black dog following you around, or the black fog, or that, or with the black cloud hanging over you. Is that the way you were living? And like, could you have fun? Could you laugh? Or was it just, it was something at the back of your head that there was always a sad feeling?
I don't think it was sadness. It was just feeling nothing at all. Like I was very good at blocking things out. So there was dissociative features. Like I said, I didn't have insight like until I ended up in a treatment centre, you know.
Okay.
So and that was the beginning of my healing journey. Like, you know, I think a lot of people who haven't any like experience of suffering in that capacity, like often think, oh, well, she went to a treatment centre for 1 month, so she must be better now. Like,
yeah, I know.
I'm including doctors in this like category as well. Like, you know, unfortunately, it doesn't work like that. And for me, going to the treatment centre and just to go back, like I had to go to the treatment centre because I made a suicide attempt. I was only found by choice, like, so. You a serious attempt.
Okay, and did you phone someone?
No, I was just actually found. It was 2 of my best friends were having their hen night.
Okay.
And they were like, oh, it's a little bit unusual that Fionnula hasn't come.
Fionnula, the mad party animal, isn't here?
Yeah, like,
all right.
So, and I wasn't really a party animal back then, to be honest with you. That's only like August Bank Holiday weekend 5 years ago. So, they thought it was unusual that I didn't come, and I lived in town at the time. So they're like, oh, we better just stop in and see if Fionnula and my fiance at the time are around, or what's going on. So anyways, they came in and they saw all the blood, and like, that's when, yeah. So.
Okay.
And even at that time, I was like, no, I'm not going to hospital. I'm not going. Like, I'm staying here.
Okay.
And yeah, so that, yeah, like I said, it was only by chance. And then when I wake up in the hospital, like, I'm still angry. Like, I'm angry that this didn't work.
Okay.
Like, you know, I genuinely spent my whole life believing I was going to be not here I never believed I was going to have a long life. Like, I always knew, like, deeply believed, like, I'm not going to live for very long. Like, so I may as well, like, do the most with the life that I have. And that's, you know, the functional medicine was like, okay, well, like, it is a risk. Like, I could easily just stay doing orthopedics, which is like a solid career path, but like, I'm not going to be here that much. So I may as well do something that's going to help people the best way I know how to do. And I know it works. So, so yeah, I always believed that, like, that was never, and I remember, I'll never forget my 30th birthday. Just sitting there and wondering, like, how in the name of God am I still here? Like, just so angry, like, angry at myself. Like, how is this not happening?
And I don't think people understand that feeling that people have when they are so low that they want to die, and they're angry that they're still here, but yet they don't actually, you know, die by suicide because they haven't done it. So, you know, they haven't, you know, gone that far. And have you had more than one suicide attempt?
Oh yeah, there was lots in the past. Like, certainly the cutting. I mean, like, if you were to inspect the legs everywhere, you will see the cuts.
And is that self-harming? Is that to let out the pain? Is that like is there that element to it too? When you self-harm, you're letting out pain, and it's like you get you get a rush of adrenaline, or does it makes you feel better because you're actually hurting yourself and you're letting that pain out? Is it a physical way of experiencing the pain that's going on in your head?
Well, I think for me it was more dissociative. So like I would always, when I'm in that state, and like I said, you know, the self-harm is very different from suicide attempts in my eyes, and I think it is for most people. Like the self-harm, like the cutting for me was always just a way to just, oh, if I feel this, that's it. It's like bliss. It's like, oh, thank God, all of this pain in my head. It's not that it's gone. It's just you don't feel anything. And I would always have to sit on a cold floor, like in the bathroom, like, and
okay.
so it was that. It's just like, it was like, oh well, at least I'm alive. Like there is actually, like, because you get to that point where like you feel so low, and like I said, this isn't pervasive. This is like 100% of the time, but in the really low, worse parts, like I've experienced just feeling like I'm already dead. Like am I alive? Like is this real? Like you feel like a ghost or a zombie just walking around? Like, can people actually see me, or am I already dead? Like, it's such a strange experience. Like, and I suppose it's dissociative.
When you say dissociative, can you explain what that means?
Yeah, so dissociative disorder, I suppose, develop in children who've experienced emotional, physical or sexual abuse, generally, or people who've been to war.
Okay.
And dissociative, there's many different types of dissociative disorder, but by and large, you're looking at dissociative symptoms, which means like depersonalization, so not feeling like change, loss of identity, I suppose. You don't feel like yourself. Like it's used. I remember so many times like going to be competing. Like I'd just be on stage like, who the hell is this person? Like who? Or watch myself
competing in your
TV.
bodybuilding, because I actually didn't say that you're also a bodybuilder.
Well, see, that's funny that people say that now, because I'm like, I never really did bodybuilding. I did like one show and I hated every minute of it. Like,
okay, but from your Instagram, one would look at you and think, that lady is a bodybuilder, or, you know, she's certainly physically changing her body.
Yeah, well, you see, that was the thing. Even when I competed in powerlifting, like I kind of looked like a bodybuilder, and that's why at my wit's end, like, trying to find some sort of competitive thing, like, to keep me going, like, so I can block all this shit going on in my head out. And as I did, I chase all these achievements, like, and everyone's saying I'm so great, I have all this discipline, like. And I'm like, I actually don't know what'll happen if I stop. That's the problem. So the bodybuilding was like literally only because, okay, what else am I going to compete in now? Like, so just, I better do this.
And can I ask you, sorry, just getting back to the dissociative first, you were abused as a child, as a young child?
All of those features. So like, I suppose if a child...
Physically, sexually, emotionally, all of them. From a very young age, or was it a certain period in time? Was it a long period of time?
I suppose from the age of 4, really, to my memory, like, you know, obviously, your memory is limited to an extent, and like a lot of the stuff I only remembered, like started to remember, like when I went into treatment centres. Okay. It's 5 years ago. I mean, Was there part of me that wish I still didn't remember? Of course, but I think it was the best thing in the world that happened to me, because I wouldn't be sitting here today as well as I am.
So only going into the treatment centre triggered the memories of the abuse, or did you grow up remembering the memories of the abuse? Like when you were in college, did you remember it? No.
Did I remember? Not all of it.
Okay.
Not all of it, no. So, like, to give you an idea, I suppose, when I went into the treatment centre, thinking, oh, I need help. Like, can somebody please just like figure out why I'm this way and like fix me? Like, I didn't think I was actually going to have to do all this work and go back to open this Pandora's box. But when I went into the psychiatrist, still my psychiatrist to this day, and all my whole life, along with my therapist. But I remember going in and like thinking, oh, here we go now. Like, another doctor is just going to tell me I'm making all this up. Like, because that's.
Have you had people tell you that you're making things up before?
Well, that's why I got into functional medicine, because that was the start of my experience with doctors. Like, just horrifying. Like, and yeah, I suppose I look back, if somebody had helped me back then, maybe.
Did you go to a GP looking for help for your depression, and you were?
No, I didn't present with depression. Well, I probably did in college. Like, but before that, it would have been like headaches. Like, I would go off myself to the doctor. Like, oh, I have these headaches. Yeah.
Okay.
Like, and obviously they're like, they don't pass any heat. And then, I had all these problems in college. Like, my skin, my tummy, like everything was just going to crap, to pardon the language. So I go on the pill. I just take all these things, like don't sleep at all, like it's insomnia for my whole experience. Sleeping tablets, like then a Roaccutane obviously is not going to help someone who's depressed, and all of these things just coming on top of me. I'm like, what in the name of God am I doing? I end up spending a month in bed in college, and I actually don't know what got me out of that bed, because I remember doing a talk a few years ago, and so nobody ever asked me the question, oh, how did you get out of the bed? I was like, I don't know. But all I know is I went out to bed and I went to the gym. I went to the gym and I met this lovely personal trainer who came up and started talking to me. Like, and I'm there just running. So that's what I used to do. Like, I used to be a swimmer, so the cardio was all I used to do. And I'm thinking, geez, could this guy stop talking to me, please? Because I just have to get out of bed from a month. It's the first time I've seen outdoor light exposure, and he's wearing the ear off me.
Yeah.
But anyways, I was like, oh. Anyways, he starts talking, and I'm like, oh, okay, eventually, like, I start listening to him, like, I better stop running here to be polite, like. And whatever happened, anyways, he gave me a training program with the weights. And I was like, yeah, I'm not doing this. Like, I was like, I'm never going to do this. But anyways, the next day I came back, I'm like, well, look, you better do it here, this program, because your man is there watching you. You can't go back in the shed.
Yeah.
So anyways, I start doing the weights, and that really brought me out of that really low period, because I started to feel like, oh wow, this feels like training again. Like, because I quit swimming because I had to do leaving cert. I had to make these decisions.
Okay.
Like, I used to train so hard even as a kid. Like, I'm pretty sure most of my coaches would have said, oh, Fionnuala's problem is she overtrains. Like, I would just go so hard. Like, love the pain, love the torture, just love it. Like, if it wasn't hard enough, I'd be like, come on, this session is not hard enough. But then
is that because you like to experience kind of physical pain, maybe, or is it more you got an adrenaline rush? Is it both? Like, what do you think?
Yeah, I suppose.
What do you think made that the goal for you when you were training?
Yeah, I honestly don't know, because there's still features.
Have you not figured that out in therapy yet? All these years of therapy later.
No, I mean, that's like, Jesus, that just gives you an idea of probably the amount of stuff that did have to be sorted out.
Yeah.
But no, the pain, I've always loved that in training. Like, now I have gotten better over the years, in the sense I still love the pain, but I don't drive myself to the point of like injury, and that's what used to happen. With swimming, I trained so hard that I couldn't perform on race days. And then in powerlifting, I trained so hard that I slipped the disc. Like, I could barely walk for 2 years, so like, that's just stupidity. Like, but at the time, like, that was my mentality, like, just go so hard, because it was euphoric. There's a euphoric component to that type of training. It's probably a dissociative experience too, because you're blocked out of everything. You can't be thinking about all the other stuff that's going on in life when you're like, you can barely breathe. There's like pumping the muscle. There's like pain everywhere, but you keep going. And like I said, even as I'm talking about it, I'm like, oh, that feeling is so amazing. To point of collapse. But
well, I know just from a personal point of view, I've always exercised, always, and now not to the extent that you do, but I'm a miserable cow if I don't. And I'm at the point now, like if I miss a day of just doing something, my mood is lower. You know, I would never have said that I ever suffered from depression or anxiety or anything like that. But definitely my mood is a lot lower if I don't. I definitely get that buzz every day when I do a little bit. It doesn't have to be something crazy, but so long as it's something. So definitely there's something to it without a doubt.
Oh yeah, there definitely is in terms of like the mood benefits of exercise. But I think even within that, like, there's different types of exercise that are going to exert different effects. Like, so although I would have loved like the really heavy powerlifting stuff, like I know I shouldn't do it because that certainly can trigger off depression for me because
really, why?
I suppose it's the draw on the nervous system. So you have to remember, like, now look, I still do the heavy stuff, but I would never go back to the 1 rep maxes, or like three reps is still like dodgy territory if I'm doing like.
What do you mean by that? 3 reps, 1 rep? I don't max.
So 1 rep max is the most amount of weight that you can lift for that exercise. For 1 rep. So it's the absolute most that you can do for 1 rep in a squat, absolute most you could do for a deadlift, absolute most you could do for a chin. So that is going to have a massive impact, more so on the nervous system, the central nervous system, as opposed to like a metabolic effect. So let's say if I'm doing like 10 reps of a squat, like I'm not going to be lifting 120 kilos because it's not possible. Let's say that's, for sake of argument, that's my 1 rep max. I might go back to 50% of the 1 rep max for a 10 rep range, especially if it's constant tension. So like that might be, so let's say that's 60 kilos. So that's more of a metabolic effect. Like it's more, you're going to be relying more on carbohydrate metabolism. So that doesn't tend to, for me personally, just the way I am, like I said, it's different. Other people, like they say, oh, the powerlifting type training, that makes me feel amazing. Like it just goes back to the whole point that what might be therapy for one can be like the detriment to another. Like I think there's a better phrase for that than the language I'm after.
So when you were when you were training for that competition that you did, is that, you didn't enjoy any of it, or you enjoyed the goal, or what was it?
No, I never. This is the thing. I never did powerlifting training. Like, I always trained like a bodybuilder. Like this was that's why I always used to look like that. You know, and I wasn't able anyways because like I just couldn't do that type of training. Like when I did try to do it, so I slipped the disc, and then I had my good friend now, Owen Lacey, training me. That was the first time I had a proper coach. Like, you know, before I was just winging it by myself. And then Owen started training me. And we were doing like more powerlifting specific, still not like 1 to 3. It'd probably be more like the 5 to 6 rep range. There would be days where I would go in, I could not move, like, you know, and he would just know, okay, this is a day. And he just put me through the paces, so at least I felt like I was doing something. But I would get those days where I couldn't lift a thing. It might have done like a 90 kilo front squat the day before, and then I literally can't do anything. And I'm like thinking, come on, like I think mentally I'm well able to do this, so I'm still there at the session, still on time, done my warm up, and I'm ready to go. And I'm like, put the weight on the bar. He's like, it's not happening today.
And is that because you did too much the day before? You're always pushing yourself too much.
Yeah, and I suppose like that has been a learning curve too. But like I said, it was the powerlifting specific type training that was never going to suit me, and still doesn't to this day. I still love lifting heavy, but I'm still not. I still learned like from my mistakes, which is something I can say is I'm proud of, like, because that has been a massive learning curve. Like, and
did it become a kind of an addiction for you? All that?
Oh, absolutely.
And even the management of the diet and things like that. Is that all about? Control. For want of a better word, is it about you trying to control your environment because maybe as a child you weren't able to?
Oh, 100%. Like I had food addiction and exercise addiction. There's absolutely no doubt about that. Like so much so that when I went to the treatment centre, they had to let me do some exercise, which is the first time ever in the history of the treatment centre where they allowed somebody to exercise. Like, look, I wasn't allowed to use weights. I wasn't allowed to listen to music. I just had a mat in the hall, and they say you have these 2 slots, 30 minutes, morning and the evening, and you take your two slots and do whatever you want body weight. But when I wasn't able to exercise, remember I've been training since I'm a kid, like twice a day sometimes, like most of the time twice a day. And then all of a sudden I'm not allowed to train. And I'm already in a bad state because I've gotten to this treatment.
It's like taking someone cold turkey off, a substance, a dependency really, isn't it?
Yeah, so I start having all these panic attacks, which I'd never had panic attacks before. And I remember my psychiatrist again saying, and this is probably why he's the only doctor I could trust, like, because I was like, this man is actually listening to me here now. So he said, oh, we're going to have to start you on an SSRI. Because of all these panic attacks. I said, well, can I please just exercise, like, and I won't have these panic attacks, like, please. He's like, it's nothing to do with wanting to be like skinny or how I look.
Yeah.
I just need my exercise.
Okay.
He's like, yeah, okay, yeah, I think we can arrange that. And I'm like, oh my God, this man is listening to me. Like, this is the first time in my life, like, a doctor I can actually have some faith in. And actually, I didn't finish earlier what I was saying when I went to him first. So when I went in first, he asked me all the usual questions. Any history of trauma? And I go, no, nothing like that. Like, he's like, any emotional abuse, like any physical abuse, any sexual abuse? Like, no, nothing like that. Like, and then he goes, he kind of under his breath goes, that you remember, like. And then I'm like, this man, again, same as all the other ones, like, he doesn't know me at all. Like, I have a photographic memory. Like, I could tell you what page, like, this topic was on from my biology book and leave insert. Like, I have a photographic memory. Like, this guy doesn't know what he's talking about. Like, so if I go thinking I'm like
cleverer than him,
yeah, what does he do? Like, how would I not remember something like that? So anyways, off I go, and I'm still like reluctant, like, to be here in the first place, like. And then I remember there's three of the lads who were walking out in front of me, and they were talking among themselves, like, and they just said something, and when they said that, it was almost, like, I will never forget it to this day. It was like, oh my God, like, the pieces of the memory were coming back from.
Can you remember what they said?
I can, yeah. They said, how could Michael Jackson think it was normal to have a child in the bed with them? And it was just, all of a sudden, it just came back, like, and it was just horrifying, like, and I thought, oh God, this place has made me crazy, like, I'm imagining all this stuff. And then I was like petrified, so I was like, why is this stuff in my head? And then I went to the chapel because I was like, I need to be, like, I like my alone time, and like when I need to calm down, I like being on my own. So I went off to the chapel and just lay down. And all of a sudden I thought I was having a stroke. So like the whole, I think it was it's always left. Yeah. So left side of my face went numb. I felt like I couldn't move the arm. It was like pins and needles. Like, oh my God, I'm having a stroke. And I tried to get up, but I couldn't get up. I was looking at the ceiling. I was like, oh my God, the ceiling's getting further and further away. And I couldn't get up for a good while. Then I eventually do get up, and I'm like stumbling, and I still can't move this side of my body. I'm just sitting there like afraid to tell anybody this is happening. And I was like, oh, I better go to whoever was in charge. I think it was like an out of hours, or it wasn't out of hours, but it wasn't their normal a day, like where the therapists are always there. Mm-hmm. And I was just sitting there, I'm like, oh my God, I'm having a stroke, like I'm gonna die. And this is like, why am I so afraid of like having a stroke? And I'm thinking, yeah, but if I die, I want to die. I don't want to be alive with paralysis, like, then I can't train. All of this stuff is going through my head. Like,
yeah, that sounds like something that will go through someone's head.
That just exactly shows you, like.
Okay.
But anyway, so obviously it wasn't a stroke, it was a panic attack, like, so that was the start.
And how old were you at that time then?
Oh, that's 5 years ago, yeah.
So it was 5 years ago that this all kind of come flooding back to you?
Yeah, so it would have been, around September 5 years ago.
And is there, in your view, a stigma associated with doctors who present with mental illness?
I think there's not only a stigma. I think like the process of dealing with people who do honestly declare their diagnosis, that process is terrible. Like, it's nearly worse than like trying to go and get help, without going into too much details. But yeah, I mean, like, look, mental illness is so common in doctors, like, whether it's depression, anxiety, or addiction, and obviously the access to substances as well in hospital. Like, we know the figures for doctors and dentists, like, with addiction. But any mental illness, obviously, for some people, they do have cognitive features. There's no doubt about that. But, you know, I mean, I don't think it doesn't, no mental illness discriminates between age, race or creed. So you can be a doctor, you can have depression, or you can be anybody else and have depression. Like, just, I can understand why, like, it has to be maybe looked at and make sure. Am I okay? Yeah. Is it going? Oh, sorry.
Perfect.
Where was I saying there? The stigma around doctors. Yeah, I mean, I would, at the time when I started to talk about it, everybody told me, oh, you can't be saying that. Like, you can't be talking about suicide. You can't be putting a picture up with a scar on your leg and people asking you why that happened. But I suppose I never really cared. Like I'm not looking for applause by any stretch of the imagination, but I think it just felt the right thing to do, you know.
As in be open about it.
Yeah, I'm like, I'm not the type of person that can like make up some story about what happened to my leg. Like, just simply not going to be able to do that. Like,
okay.
And I'm not going to cover it up. Like, I'm not going to, if I'm wearing shorts, I'm not going to wear leggings in the gym because I have to hide the scar in case anybody asks me what's it from. I mean, most people don't really ask anyways, but
yeah.
I don't think, like I said, part of therapy for me anyways was about discovering myself too. So I'd lived so much of my life like trying to make everybody else happy, you know, like do what everybody else wants me to do. Like, people see a doctor, they want you to behave a certain way and they expect you to, you know, conduct yourself in a certain way. And yeah, just when you're in a professional environment, of course there's going to be standards there, but like, your doctor's still a person at the end of the day, like, and it is okay to have interests outside of.
Well, yeah, that's what drew me to you in the first instance. I actually started following Fionnula on Snapchat about 7 or 8 years ago.
I was in London at the time.
I know you were with your coffees and with a gentleman called Vinny as well. And I just remember thinking, Jesus, this one's a doctor. She's fairly putting herself out there with her racy gym gear and her sexy body, and, you know, just kind of being open about your lifestyle. And I thought it was quite new because, like, I know there's lots of it now where we're a little bit more, I suppose, woke in inverted commas. So we see doctors, which would have been, you know, they would have been, you know, the profession that are maybe put up on a pedestal and revered by many others, and I maybe considered like to be, you know, godlike and not be normal, let's say, or like go out the piss, or, you know, not like everyone else. Yeah. But in actual fact, we see it now more because of social media that, you know, doctors have lives too and they go through the same struggles that we do. But I suppose you're a little bit even still more above that. There, like, yeah. I did check out your OnlyFans, Fionnula. It's very racy.
But that's the thing as well, you know, like we'll get to that maybe soon, but it's just like I tried really hard, like back then, like before therapy, to do all of these things, to be a certain way, and like it didn't really get me anywhere. Like, you know, it just, you know, that's just not me, like, you know, as a person. And like, no matter how much I love my work, like, it actually wasn't worth trying to pretend to be this person. And ultimately, I suppose, like, the way the world is, like, some people are going to like you and some people aren't. Like, if someone doesn't want to come to me because, like, they saw a sexy picture of me, then, like, fine, you know.
I think it'd be quite the opposite. Do you not have, like, stalkers that just want to scope you out?
I actually don't, no, like, because, you know, and that's fine. Like, it shouldn't detract from what you do for a living. And yeah, like, maybe I'm pushing the boundaries a little bit in that regard, but like, I'm a lot happier than I was when I was trying to keep everything hidden. Like, don't let anybody see your personality, because God knows what they're going to think, especially in Ireland, like, you know.
God forbid.
Yeah,
but even coming out with your story about suicide and the trauma that you've been through as well is quite unique.
Yeah.
And the fact that you're so open about it, because I know that we are making progress with mental illness here in Ireland, and we're a little bit more open to discussing it. But like suicide attempts and wanting to be dead and that, there's certainly a stigma attached to that.
Of course there is, yeah. It's because people don't understand it. Like, you know, they think, oh, there's something really wrong with this person, like mentally. Like, you know, they don't understand, like, this is a disease, you know, and nobody ends up like that unless something pretty bad has probably happened to them, you know, like the brain is not wired to work like that, you know, there's not we're supposed to be like surviving, and brain is supposed to do everything it can to survive. So when someone has those thoughts or has made attempts in that way, whether it's self-harm or suicide, like it's not something that people should have a stigma around or a judge, but like feel compassion. Like, why is that person experiencing those? What has happened to that person for them to feel that way? Like, why is it so hard for that person to live in this world? Like, and I think that's the problem. Like, you know, it is more common than people say it is. And like,
but do you think that something has to have happened, someone to get to that point, or do you think that it can be like they're seriously depressed and anxious and sad, they have an imbalance of chemicals in their brains, and that's the way they are, or that's their genetic makeup, or something triggered it, rather than having like the serious traumatic childhood that you had? Because you know, they do, I'm not sure if is it a case of, I don't think it's a case of necessarily someone that commits suicide necessarily has to have had a seriously traumatic event in their lives.
No, not necessarily, but I suppose trauma is like individual as well. So I think for anybody with mental illness, it's multifactorial by and large. You know, some people will have genetic Snips, like it makes them more susceptible. Or a wide variety of other physiological factors for sure. Like, I mean, I would presume that I have some of those bits and pieces, like, you know, I mean, but I suppose it's a combination of things. And like I said, like, obviously, obviously I see a lot of patients and they tell me their stories. So for me, like, other people listening, just, I think it's important to say, so other people might be sitting at home listening and they think, oh, well, like, I kind of have the same symptoms, but like, I didn't have all that awful stuff happen to me. Like, you know, I'm okay saying that, that's fine, you know, but trauma doesn't have to be those things. Like, I mean,
it's individualistic. It can be,
it could be something as small as like how, you know, somebody shouted at you regarding something about your face or something, like some, you know, the most thing a lot of people will look back when they're saying these things to me and be like, oh yeah, it wasn't really a big deal at the time. I'm kind of like, okay, that kind of was. Or the parent was alcoholic, you know, which is so common. Like nowadays, when we look back at the way Ireland was back then, certainly in the west of Ireland, like I don't really know about this area of Ireland, but certainly back then everything's kind of kept swept under the rug, and like alcoholism is just kind of, you don't really talk about it, you know. Like, I mean, I don't think back then, I probably should not say that. So, where was I going with that?
We were just talking about suicide, and you were saying about the fact that, you know, it's that a traumatic event has happened in someone's life. And I was just kind of trying to qualify whether or not, like I didn't think that it was necessarily that something traumatic had to have happened, but maybe that people were feeling in an awful way. It was a chemical imbalance. It was a depressive-like state that they were in, to have wanted to attempt to, or have succeeded to take their own life. That was mainly it.
Yeah, and like certainly there's going to be people with like I said, those Snips, or they like have genetic components, like, or they have other physiological factors. But like I think the serotonin hypothesis, certainly in the cases of like depression, is quite a limited view of how depressions work. Like I said, I'm not a psychiatrist either. I'm really purely talking from my experience, like of mental illness, and I suppose with the nature of the type of people I see, like they are looking for other ways to improve their condition. So of course there's elements, and I will say to them as well, like, you know, by and large, like you can do all of the physiological work, you can do all the tests that are available to you, and you can address every single piece of that's in it. You can take the supplement to fix this, you can take this diet to fix that, but my view is, like, if you don't address the psychological element, like, you're probably not going to get very far. Like,
as in therapy?
Yeah, therapy, like, you know, it's like the best thing I've ever done in my whole life. And it's like I say to people now, like a lot of people think, oh, well, I don't have any depression, or I don't have anxiety, or I don't have OCD, or I don't have addiction, so why would I go to therapy? It's like I say to people, like, oftentimes people end up going to the gym or exercising because they carry an extra weight and they want to lose the weight, right? So say somebody's like, oh, look, I need to lose a little bit of body fat. Like, no problem in wanting to do that. Sometimes now we have to be so careful about saying these things, but there's no harm in that. So they go to the gym, they start a diet. Now, when they lose the weight and they're happy enough with the body weight they're at, let's say they're all of their things, their blood pressure is improved and all of these blood markers have improved, as you might expect with someone who loses a little bit of body fat if they were carrying too much. They don't stop going to the gym when they lost the weight, like, you know, so they keep doing it. They might not do that same frequency as they did when they needed to lose a bit, but they keep going, like, to maintain it. And the same thing I see with therapy. Like, okay, I'm not massively suffering with any major symptoms at the moment, like, but I still go. Like, I still go every week, every 2 weeks.
That is an interesting analogy, actually. That gym analogy.
Yeah,
I never thought. So you don't have to go to therapy. Did you just come up with that just now?
No, I've come out
all right.
that before. Like,
all right,
I like
it's very nice. I like it. Yeah, because, you know, you don't just go for trauma therapy or therapy in general just to deal with that. It's more like a, you know, it keeps you going, keeps you on an even keel.
It's like
so you just go sometimes and just have the chats, like what you did this week, or do you always delve into something really deep and awful?
Well, like, say for example, like, even with relationships, like, I have to be careful, like, in that sense, because, like, you know, my history of, like, picking the wrong men and not being able to see these red flags speaks for itself. So
what are the red flags?
God, you know what, like, narcissism is usually a big one I have to try and avoid, like, but,
okay, you
know, I suppose even things
and
like
as you're attracted to, like,
I would have always said I don't have a type, you know, but if you ask my therapist, she would say, oh yeah, like, you definitely do, like, something to do with how they look, but it's their behaviour, like how they text you back or something like that. She knows these things, but I can't always see them at the time. Like, I'm like, oh, that's so funny that he said that. And she was like, no, that's not nice. Like, or like recently, a guy was saying, oh, like, don't wear shorts, like, because everybody's going to be looking at your legs. And I'm like, man, I always wear shorts. It's the summer. I haven't worn shorts since, like,
and I have a fine pair of legs, actually. So.
You know, I was like, okay. She's like, yeah, that's not good. That's not normal. Like, all right, okay. But, you know, it's just simple things. Like, I mean, for someone else, they might think, oh, how can she not see that? Like, but look, nobody can see everything. We can't go outside of ourselves, like, short of taking maybe MDMA or something, like, as part of a trial, like a clinical trial. That's the purposes of these trials, is so that you can kind of go outside your body and look at your life from the outside, and that's why it works. Sorry.
Have you ever done that?
No, I have not done MDMA.
Do you see the validity in those trials?
Oh yeah, and if it was an option to me, 100%, I think I would do that, because... But
only under the strict clinical trial process, not just go out and take one.
Oh God, no, because remember, the only way it works is because you're there with a therapist. So, like, I would only feel comfortable to do it with my therapist, like, because she's going to know what stumbling blocks I still have. Like, you know, there's still parts I don't remember, and like she says, maybe that's okay. You know, it's not as if I'm, like, plagued by these flashbacks.
Just for our listeners out there, just explain what the MDA is.
Oh, sorry. MDMA is, most people would be familiar with ecstasy. Yes. So, look, that's obviously a recreational drug that people would be familiar, but now they're doing a lot of these clinical trials, like whether it's MDMA, ketamine, psilocybin is another one.
Yeah.
But like today, I think one of them recently got FDA approved in the US. I can't remember offhand now.
I don't know which one it was though, but yeah, I'm keeping a close eye on all that. I'm very interested in that area of psychiatry because I think that we perhaps have been too against that process, because they have seen quite a number of significant, you know, differences in people after they've taken these. But obviously, like you say, it's under the controlled environment. But then you do wonder, people that do take them recreationally, what are they doing to themselves on a regular basis? Like, you'd have to kind of maybe worry slightly about that. Yeah,
and also remember, there's a huge amount of polydrug use as well. So whereas somebody might just take MDMA, like, it's unlikely that somebody's just taken MDMA. They might have had a few drinks and then they do MDMA. Maybe they've already done a bit of cocaine, and, you know, then they might smoke a bit of weed, like, to, you know. So it rarely happens, I would imagine, like that. People just go off and do MDMA. Now, I do have some clients, like I said, and I don't guide them in any way, but they will tell me that they go off and they do these things purely for, like, the benefits, and they go off they sit beside a tree. I remember somebody was telling me before, and all of this stuff comes back. Now, I'm not by any stretch of the imagination recommending that at all, but like I think the control setting, there has been good results. And I say the only reason I would have faith in it, aside from the literature that's come out, is I suppose the premise of it. So being able to ultimately, like a medically therapeutic dissociation from yourself, so that you can maybe look inside and see, like have the compassion for yourself. And ultimately, I suppose with MDMA, to my understanding, that maybe you can start to remember things that in like normal conscious setting we can't do, which is the case for me.
Because with psilocybin, that's, that's the chemical that's in magic mushrooms. So interesting studies that were coming out in cancer patients that were taking psilocybin. So they would have been fraught with anxiety about their impending death, especially if it was terminal and they were, diagnosed with terminal cancer. But one dose of psilocybin relaxed them and allowed them to be able to just live their life day to day and not worry about the terminal prognosis or diagnosis that they had. So I think that there's, like you say, definitely, I think that like say when, 10, 20, 30 years time, when I'm hopefully retired, that there'll be interesting therapies brought out. But obviously, America will probably pave the way like it normally does with these things, maybe in a controlled setting as such. And then we'll, kind of fall in. But then there's the whole argument there, as big pharma, grabbing this and charging loads of money for something that, people can just pick on the road, pick in a forest and take, there's those arguments too. They have to get it right. They have to get it right.
Exactly. It's the same like the medical cannabis. Like, of course you can go off to a dealer and get a bag of like the cannabis, like, and start smoking it by yourself. Like, but inevitably, like, it's not going to be the same as like it being, the
regulated
dose, like, you're a pharmacist, so you know more about that than me, but like the dosing, like the method of administration, I presume all of those things are relevant in terms of administering the correct dose. Like, so.
Well, absolutely. And the percentage of THC being standardised and that, you don't know what you're getting when you're getting it off the street. And did you ever self-medicate with recreational drugs? Like, the way a lot of people that would suffer trauma and potentially suffer from mental illness, they do self-medicate in any way, shape or form they can, whether it be exercise, sex, eating, drugs. Did you ever go down that route or dabble to try and make yourself feel better or not?
I don't really feel comfortable to talk about that at the moment, if that's okay.
Oh yeah, of course, no problem.
Thank you.
We'll move swiftly on.
Okay, thank you.
So what were we talking about then? The whole functionality of the medicine and what you do for people then in terms of prescribing a diet for them, prescribing their exercise routine, and how does that all kind of holistically come together for them? Like, do they start out of the trap straight away after their initial consult and then they go from there? Is it constant tipping in with you, or? Yeah,
so I suppose it's going to depend very much on the person too, and that's another good reason I'm trying to get to know the person. So for some people, like most people now, I'll be honest, want to wait until they already have the test. So like I said, and I, to be honest, encourage it by and large, because if we're going to embark on a diet, it's never easy. Like, there's always going to be something that maybe we have to take out, even if it's just for a limited time. And that's largely what I would do with people. They're medically therapeutic diets to address issues on a test, rather than a long-term, lifelong, this diet for the rest of your life doesn't work. And so in order to get the best results, adherence with the patient or the client, I think it's always valuable to already have like the test, so they know why they're doing it. They know the timeline, the ideal trajectory for them with the diet, and what comes after that. So depends on the person. Like I said, I might give maybe some soft interventions after the initial consult and say, okay, maybe try these things while you're waiting for the test to come back. I might recommend some basic supplements initially just to maybe help them feel a little bit better. But ultimately, I suppose the body of the work comes after we have the test results that are guiding what to do or don't have to do,
And do you do the vitamin infusions?
Yeah, I don't do a huge amount of them anymore.
Okay.
I think they've gotten such a bad
press.
Oh, it was just because lockdown, I didn't really feel like it was appropriate, like, to be doing IVs when there's so much going on.
Okay.
They're not like an urgent thing.
Okay.
But yeah, so I think like the IVs have gotten a really bad rap, I think. And look, it is how you use them too. So it's the same as vitamins that you take orally. Like they're vitamins at the end of the day. And I always say this to patients and clients. Like if you have enough vitamins and you take an IV infusion, it isn't going to do a damn. Like, you know, like if vitamins go to this level, and for some, if you go too high, there are going to be toxic side effects. So the fat soluble ones, I don't do at all. But if you go up to that level, there are toxic effects. You can run into trouble. With the water soluble, you just kind of pee it all out. That being said, some people don't have optimal levels, and if you replace them, but you do it in a strategic way whereby you have testing at least to guide you, then those people do get good results. So certainly for people. And it was something that I used back in the day when I first started doing them, and I only came across them by chance. Like, so it's a funny story, but yeah, when I did come across them, like I was as skeptical as the next person. I was like, what is this nonsense? Like a vitamin injection. Yeah. Then the first people who had asked me to try and figure out how to do it for the purposes of their sport, like, oh yeah, okay, I'll go off and do the courses. Like, look, it'd be interesting to learn this stuff anyways. Like, so off I go anyways, went to Seattle, did all of the courses or whatever, came back, was like, okay, lads, let's go, we're going to do this. And I'm like, I'm not doing it on the day that you have to perform your sport, but I want to do a trial run before we go over to the States. So anyways, we do this and I'm like, oh jeez, this is such a waste of time. But I'm going to do it. Look, I went over, I learned all this stuff. We'll see. Then I gave a lot of them what they needed. And all of a sudden I'm getting all these messages on the phone like, oh, Fionnula, when can I do another one? Like, I feel so amazing. You know, like, can we do another one maybe tomorrow? And like, you know, like, a lot of them. I was like, what the name of God?
You got a rush.
I'm like checking. This is definitely vitamins matter. Okay, that's a joke just in case anybody comes back to me. So I'm like, what the name of God? I was like, yeah, no problem. We're not going to do it again because again, like they're vitamins. Like, so doing more like is not going to exert better effects. No more than if you take an oral supplement and you don't need it, it's not going to do a damn. It's just expensive fee.
But also if it's an infusion, it's one off. So how does it stay in the body? You know the way if you take an oral one every day, at least you're getting into the body every day. So if it is an infusion, so isn't it excreted like that day if you don't need it? Or
exactly. Of course it will. And like it does. That's even what I would say to people is you do take the oral supplements in between. Just because you get one shot doesn't mean that's going to cover you for the rest of the month. Like you just get these infusions. And equally, the other thing important to mention with the IVs is first and foremost, if you are getting benefit from it and you are noticing an effect, like for the mood, for the energy, whatever it happens to be, well, why are you not absorbing the nutrients orally? Or like, look, I mean, most people probably do need to take an oral supplementation, but if you are noticing such a big boost, i.e. potentially your levels are quite low, so the IV is giving you a boost, whether it's just the B12, which it may well be, or the B6, or the magnesium, depends what's in it. Like why is that? So is there something wrong with your gut? You know, do you have maybe a snip? You know, why aren't you properly utilising it from the food or the supplements that you're taking orally? So like I said, if it's for the way I would have used it, like, look, it's different for athletes. Like if they're cutting weight, they are nutritionally depleted. So when they take it, of course, it's like this nootropic effect they're almost getting. And I have experienced that too. Yeah. But that's like they're cutting weight. Like, so they're like on.
Can you explain what nootropic is just for our listeners?
Oh, so like, how do I even explain that? It's like,
nootropic means an effect on the brain,
so
cognitive
it's cognitive
function.
enhancer. But I suppose it's also going to be like a mood boost. Yeah. And mood, and sometimes people refer to mood as just being sad or happy. But the motivation, drive, desire, all of these types of things, I suppose more dopaminergic. So desire.
I was reading some man said he took a vitamin infusion and he had a raging heart on the way home that he couldn't get rid of.
Oh yeah. So this is the funny thing with the magnesium. And like I say to all my guy friends, so like, listen, like you might be getting an erection, like that's normal, don't feel awkward. And like I've experienced too, like you go start to get the magnesium, it feels really good down there. Like, whoa, geez, no man ever gave me that sensation before. Give me more of these IVs.
I'll take my IV and my rabbit and I'll go off.
Exactly. Have a great
rampant rabbit. I mean, it's the Alzheimer's vibrator I'm referring to, not the actual animal.
Or you need the one that does the thrusting and the clitoral stimulation. Like I think that's look. Obviously, it's different for everybody. But that's my favorite.
Point noted. Noted for Christmas present on the way to you, Fionnula, in a few months' time.
Oh Christ! Like this conversation took a turn. But yeah, the erection, or like I suppose like the pleasurable feeling in the nether regions, is largely from the vasodilatory effect. So that's like niacin or the magnesium generally.
And isn't it general when they're relaxed as well?
Yeah, exactly.
So it can be to do with that too. And then obviously that, you know, when men get excited about things in general, sometimes it's reflective of in their pants too. So I think
it's a good sign, like, you know,
absolutely sign of health.
Things work in order is the way I see it, you know. But let's say if there's been friends of mine or whatever, like, or not even like just people I would know, they're just sitting there like so awkward, like, and he's sweating. You're like, oh God, it's okay.
It's
fine.
okay.
Like,
I've seen it all before. Before.
Like this, as it was, I was like at the start doing them. And I was like, oh, like, I better not say this now. Like, but then as I got more confident myself, then I just say to them, look, if this happens, don't panic. It's fine. Like, it happens all the time.
You'd be very doctor about it.
Yeah, exactly. Yeah.
Can I ask you what you think? Because there is a school of thought out there by mainstream medicine that functional medicine is quackery. You know, it's unfounded, it's pseudoscience, it's kind of based on, I was actually reading there about it, just doing a little bit of research last night about the thoughts on it. It's like, it's based on founded philosophies and unfounded philosophies, or founded, like, you know, like trials and trials that have just, you know, they haven't worked out. So what are your thoughts on people that would say that and say, oh, you know, it's crazy, it's like, you know, crazy science?
Well, yeah, I suppose the reason I do it is because it is very scientific, you know. That's why I got into it, like, is the molecular end of it, like. So, and the other thing to remember as well, like, back in the day when I first started doing it, it was very new and people were more skeptical. But you have to remember as well, like, they have functional medicine centres now in Cleveland Clinic, Mayo Clinic, Johns Hopkins, like, so it's like, look, I shouldn't really have to do a lot of work. Like, if it's in all these top centres, like, look, that's I suppose, like, sometimes you do just get frustrated. And I suppose, like I said, I've been doing it a long time now. So now I'm just like, my hands are tied. Like, no matter what I say, you're going to say something back as well, you know.
Okay.
But the thing is, I suppose as well, when people are looking at the research studies, like, remember, even if we look at the IVs, okay, there's no real literature if we look at the combination of nutrients. So a Myers cocktail, for example, there's not a huge amount, if any, on the cocktail itself. But if you look at the individual nutrients, like, you will find the literature there. Same thing with the functional medicine. I suppose you're not going to find, like, the Journal of Functional Medicine that I'm aware of. But if you look in depth into different journals, then look, it's like the way I do it is all based on research. Like, you know, there's the microbiome stuff is only exploding now. Like, the thing is as well with the nutrient side of things, you might not find it in the main. Like, you might not see specific papers in the main journal, but if you don't look, you don't see. And that's something I've learned over the years as well.
Yeah, and that's about finding all that out as well.
And it might be something like, you know, something really small that you might work for one patient, but it's so specific as well. Then, like, okay, that totally doesn't apply to someone else. So, in any case, look. There's different people who do functional medicine. Like, the same way, there's a whole lot of GPs. Some are good, some are bad, some are indifferent. There's a whole lot of gastroenterologists, some good, bad, and indifferent. Same thing with functional medicine. The problem is, they're not all doctors. Like, so, and there's no problem with that. There's a lot of people that I know who use functional medicine methods in, like, a personal training setting, like, and that's fine. But I suppose from, like, a functional medicine education, like, I wonder that it must be difficult to do without having some sort of background in medicine or science or something like that.
Yeah.
And so, like, I can understand maybe why people, if they've, you know, listened to different people saying this, that, and they say, okay, well, that person is whatever nasty terms they're going to use to describe them. I don't think anybody does anything out of badness, like. But if they don't have, like, it's very hard to do. I think it would be very hard to do functional medicine if you didn't have, like, a medical degree or a science degree, probably more so than anything else.
But do you think that the fact that you have a medical degree and that you've done the medical stuff, I suppose, for want of a better word, gives you the edge in terms of you obviously have an idea of how the body works, disease states, etc. And I know that, say, you know, people or doctors will treat, say, an area. So there'd be like a specialist in, dermatology, a specialist in cardiovascular, whatever. But functional medicine is more about treating the whole person. Is it more like traditional Chinese medicine in a way where people go to the doctor to stay well rather than going to the doctor to get cured of an illness? Or is it people come to you because they have just found they just haven't managed to get the help elsewhere, or whatever they've tried before hasn't worked? So what, or is it just a variety of people that would go to someone for functional medicine?
Yeah, there's a variety of people. And like I said, I've been doing it a long time. So there's the athletes, who want to use any little thing they can do to maximize performance. There's people who come purely from a preventative perspective. But then there's a huge amount of people, I suppose, that come when they do suffer with chronic diseases, like whether it's IBS, or IBS is a common one, whether they have a diagnosis or not, depression, anxiety, maybe not like at the severe end of the spectrum, but people who have problems with energy levels, and maybe like, I think with symptoms like that, like it's very hard to do like a standard GP test. So what you see in people is like, let's say if they have really poor energy and it is very distressing to the person, like they're like, I'm so tired, like I can't think straight, like my job is suffering, but like it's hard for a GP to do a lot with that by virtue, I suppose, of the standard test. And I suppose we people like that look, they're not acutely sick, but their life is not good either. Like, so there's that side of it too. So yeah, their symptoms may be very vague, like, but and if they don't have a thyroid problem or they don't have a overt sex hormone problem, they kind of are like just, it's chronic fatigue disorder, and away you go. Like,
so ME.
Yeah.
Do you see people with that, like that kind of chronic fatigue? And
yeah, fibromyalgia, all of those things.
And so fibromyalgia, one would hear that it's, in someone's head.
Look, I've heard that phrase told to me before, and like fibromyalgia to me is not dissimilar from depression. I think it's oftentimes people who don't like to take or won't accept the diagnosis. So they might not have any mood disorder. So it's like I said to people, oftentimes depression is not that you feel sad. Like I can not think of many times where I felt really sad as such. Like it's a normal emotion to feel sad. Depression is feeling nothing generally. And they have physical pain, and like, look, at the end of the day, like if the brain isn't working properly, like you may well feel pain in places where there's no injury. I suppose how do we perceive that pain is a neurochemical phenomenon as well. So if there's a disruption there, like you may well, like I said, you may well feel pain, but I think
it's not pain that's recognised on an MRI or on okay.
It's not like you're imagining. It's like it's not that you're imagining the pain, but remember, it's how you're perceiving it because of the biochemical changes in the brain. You're perceiving pain. That's not. There's no injury. There's nothing that we can see on a scan, but I'm not saying that the pain is not there.
But it must be devastating for patients and people to be told that's all in your head. Yeah, they're experiencing pain, they're experiencing fatigue, their hormone levels are fine, their everything, their blood work comes back normal. Yeah. And then, so they're told it's all in their head. Like, how do people... I think the all in your head phrase is not good. Like, no. Again, that's exactly what I was told. Like, back in the day, I had abdominal pain. Like, literally look like I'm like carrying twins here. Like, and it's all in my head. And granted, like there was an element of truth to it in the sense that it obviously was psychiatric, but it wasn't that I was imagining it. And I think that's the way it can come across. So I suppose it's, again, certain amount of acumen there in terms of how you phrase things to people. So it's not so much that it's in your head, but like, yeah, it's like I would explain to people, remember, everything that happens from the neck down is governed by the brain, and that's what makes us human. How we experience our surroundings, how we like see, like how I'm seeing you in front of me, that's my perception of how my brain is processing those visual images. What I'm hearing, like how I might interpret your facial expression, like, or the best one I say to people to conceptualize how big the role of perception in the brain is if we look at someone who suffers from anorexia nervosa. So if anyone has ever come across somebody, you can see that visually. The person's skin and bone for the most part. There's nothing on them.
like when they look in the mirror, they genuinely do see a person who's much larger or carrying a lot more body fat. Like their brain chemistry is so disrupted that the perceptual centers are saying, okay, this I'm actually they see a much, like they genuinely see a much bigger person in the mirror. So if the brain can do that under the conditions of that disorder, imagine on a more subtle level, like if there was anything else going on in a different part of the brain, maybe we might see the world as bleak, as hopeless, as like there's no point in being alive, or that we're worrying about something that doesn't exist. So it's the same with anxiety. People say, oh, like everybody tells me I shouldn't be worrying about this, I shouldn't be worrying about that, but I always be worrying about this. Like, yeah, that's anxiety, and that's part of the disease, and that's part of the disorder. It's not you as a person, but it's a disease state. And I think that therein lies the problem with psychiatric issues, is being able, as a patient, being able to acknowledge that this is a disease state, this is not my identity,
Yeah, I know. And that's the whole thing, isn't it? It's not my identity. I don't have to live by this identity, and maybe it's something that I can hopefully get over, but it's so tricky with mental illness because you can't look inside a brain and scrub something away.
Well, like there's a guy in the States called Dr. Daniel Lehman, and he does a lot of MRI scanning. Now, I don't know the ins and outs of the diagnostic techniques as such, but he can do a lot of work for people, like in a sense of being able to identify bits and pieces. So if someone had an injury, head injury, be able to detect that. So he'd be able to detect certain centres of the brain whereby there's a disruption, an ADHD and things like that. So he has probably brought a slightly a better edge maybe in terms of diagnostics. Now, like I said, he's relatively new in his approach, but like
does he like see something on the brain and then prescribe medication, or
he'd be very much lifestyle centered as well. And I suppose he had, like you say, we works with like Justin Bieber, all these like celebrities in the States. Like I can't think of anyone else offhand, but who has Justin Bieber? Anyways, he's worth following on Instagram if anyone's interested. But yeah, he would definitely take, I suppose, more of a functional medicine approach ultimately, But he, like I said, in psychiatry, he's a psychiatrist, and he like I said, he can do all this imaging. Like I said, I don't know the ins and outs of it, but it is quite interesting the way he can like pinpoint one thing to another, and use those nutritional interventions as such. Like if there's an inflammatory burden and things like that, an anti-inflammatory diet, like I say that in inverted commas because there's many different variations of that for one person or another. But yeah, I think down the line we hopefully should get more of a like objective insight into what might be going on for someone. So whether it's a case of we're looking at the Snips for serotonin receptors, stuff like that, or your man scanning. Sorry, your man sounds terrible. Like Dr.
When you say Snips for serotonin receptors, can you explain what that is? Just
okay, so Snips are single nucleotide polymorphisms, and they're small changes in the DNA. So like the serotonin receptors ones, they might have a slightly different ability to read the serotonin sign, to keep it simple, or like the MTHFR gene, which a lot of people will have heard of these days. Like, so if we have a SNP in that gene, so the methylene tetrahydrofolate reductase gene, that influences what form of folate we maybe need to take in orally, and how our metabolism works in the brain, and can set us up for problems with mood disorder, to use one example. So SNPs are small changes in the DNA. They don't make us look any different from anyone else. We wouldn't overtly know unless we tested. But those are interesting things, maybe.
It's so funny how you can change from talking about your man to literally like a science teacher, science lecturer. It's great. I love it.
Yeah,
you switch. Your eyes light up as well. It's wonderful to see.
Yeah, you have people on Instagram. They see me doing, like, if I'm answering questions on Instagram, they'll be like, "Who the hell is that?"
I know. I know.
Like, you don't talk like that.
You don't look like you're going to talk. Isn't that it? It's so funny the way that someone's perception of someone and the way they look and the way they act and the way they might speak, in a colloquial way, and then you can just start reaming off scientific data. It's a good feather to have in your cap. You did mention the microbiome. I'd love to get into that with you a little bit more deeply, because it's one of those things that, I've been a community pharmacist for 20 years. And when I first came out, 2003, I suppose it was, the probiotics weren't really a massive thing. And it was considered, a little bit, sure, listen, it's not really anything, you're not really taking it. But I certainly saw a difference even with recommending probiotics to people, like what you said, with people coming in with IBS and, just various gut issues that weren't necessarily a diagnosis of anything. So, and now, like, you know, even in the last few years, there's been an explosion of information to do with the gut microbiome, the gut-brain axis, and whether or not, like, obviously the food that we eat really affects it.
Oh yeah, as number one.
So can you discuss a little bit about how the work that you do affects the microbiome and how people's just general makeup is affected by their stomach, their gut?
Yeah, I suppose the microbiome is such a massive topic in the literature and has been, I suppose, over the last number of years. And I suppose maybe to take it back a level, the microbiome ultimately is the collection of bugs within the gut. So probiotics are a supplement that we take as good bacteria. We put it into the mouth and theoretically it should boost the good bacteria in the microbiome. But the microbiome, I suppose, those bugs in the gut are responsible not only for how well the digestive system functions, how we absorb nutrients, some of them help make nutrients. They also are responsible for, they have a role to play in how the immune system works. And I suppose that will have an impact on susceptibility to infection. So we always see the ads on TV about the probiotic.
Actimel or something like that,
that's the one,
isn't it?
Yeah, like, oh, take the Actimel drink now. And
You'd be grand.
yeah, it's fortunately not that straightforward, like, but
Yeah.
So susceptibility to infection, autoimmune component as well is part of that. Allergies and intolerances. So, like, a lot of people will say, or they do food intolerance tests, you know, and the reality is it's probably not worth doing that unless you've already done maybe a stool test, because if you have a dysbiosis, i.e. an imbalance in the microorganisms in the gut, whether that comes from a pathogen, i.e. a parasite, a bacteria there that's not supposed to be there, a pathogenic bacteria or fungal overgrowth, or you just have a disruption within the commensals, that will affect the immune system such that you may get different results on a food intolerance test, like from a Monday to a Wednesday to a Friday. So, like, I wouldn't recommend anybody does it.
Okay, that's really interesting.
So it's just kind of waste of money, to be honest with you. Like,
Okay.
I don't know, maybe somebody has a perfect gut. Like, I would love to see this person, but
So are you suggesting that people have intolerances to certain foods all the time?
no, what I think a lot of food intolerances come from is like a microbial disruption, as opposed to them never being able to eat that food. Now, it's like I would say to anybody, like, if you eat Domino's pizza, like, don't be expecting to be feeling 100%. Like, that stuff isn't supposed to be coming into the tummy. But I suppose I see a lot of people that have already, like, started eating clean. They're already doing all the, like, standard health stuff. Like, so, you know, the traditional wellness stuff. So they're already at a stage when they come to me, they're already doing the things that you would instinctively think of maybe they should try. So they're already eating clean, like, they might be taking probiotics or prebiotics or glutamine or whatever they're taking, and they still have symptoms. Or they will say, look, someday I can eat this broccoli and the next day I can't. So you're not talking about Domino's pizza here. You're not talking about Five Guys burger and fries. Like, you're talking about broccoli or water or chicken, some part of the chicken. Like, you know, there's these really specific things. You're like, it's not the food. It's why is that's to say to people, because they get to the point whereby they're so restricted in what they eat. Like, you know, they literally they're so like, I can't eat this, I can't eat that. And like, this is clean foods. I'm not talking like Haribo and all that sort of stuff. So it's not the food. Like, you know, we are generally supposed to be omnivores. Like, so it's more why is my body responding in this way to the food? And those reactions tend to be sporadic. So they may be able to eat it one day, they can't eat it the next day. There's no real consistency. If you were to say, like, give them the 72-hour window, if I eat this, eggs, another classic one. You know, it's not really normal to be having a reaction to eggs. Like, it's such a healthy food. So like I said, that often comes back to microbial balance. And I suppose once you address the microbial element, then they don't tend to have the same amount of food intolerances, or they can eat a much wider variety.
And just to be clear, we're talking about intolerances here. We're not talking about food allergies, which is totally different.
Yeah, sorry. So
because when you said eggs as well, like, I know that people would be actually allergic and die from it. But this is intolerances that we're talking about.
Yeah, so like, if it's a nut allergy, like, you don't be going near the nuts no matter what microbial treatment you be doing.
Yeah,
like,
exactly.
or celiac disease, like, you know, there's so no, it's those are different, from the intolerances. And thank you for pointing that out, because I could be in a lot of trouble there.
Just to make sure that people understood what we were saying. I wouldn't want them thinking we were trying to
mislead.
Yeah.
So, we were talking about the immune system and then the role of the microbiome in terms of how it affects the brain. So a lot of people would be familiar with the gut-brain axis, and I suppose to remember that communication loop is bi-directional. So while what happens in the tummy can affect the brain, and when we're talking about the brain, I'm talking mood, cognition and behaviour. So often we say, just you can eat happy food or whatever. Like, it's not just about being happy or sad, I suppose. It's things like brain fog can come down to an issue with the gut. Energy. So like that energy for most people is usually more of like a psychological issue than necessarily like they don't have enough calories or they haven't eaten enough carbohydrates. And what I mean by that is maybe motivation, drive, like the will to want to get up and do these things. So someone might be sitting there like, I have a load of these freaking house chores to do, like, but they're going to have to wait, like, because it's not that they don't have the physical energy. It's not like they overexerted themselves in the gym. It's not like they didn't eat enough calories or didn't eat enough carbs, didn't eat enough of a ketogenic diet, whatever it is. It's that they're lacking, obviously, the whatever's going on in their brain biochemistry wise. So once you address those things, oftentimes those are the things you look for in a follow-up. So like how are you getting on with the house chores or whatever? It's like hoovering the house or like cleaning the dishes. Like, my husband said it's amazing. Like, and look, I know that's a very sexist thing to say, but it could be the other way around too. The husband might be saying, my wife's so happy, I started doing the washing, I started folding the clothes. So those are subtle things, I suppose, to look out for in people, and it's important to ask those questions, because sometimes you have people come back and say, I didn't really notice any difference, to be honest with you. Like, and then you're like, what about this? Or to be fair, that's much better. Or
okay.
Like, so I don't know how they're talking about that. But anyways, we're talking about the role of the gut and the brain. And so mood, cognition, behaviour. So the cognitive features, like short-term memory, focus, concentration, all of those usually shift if there is a microbial issue. Like, there's obviously other causes for those symptoms as well. But if there's a microbial issue, i.e. a dysbiosis or whatever it happens to be from whatever source, that can affect that. But again, the brain can also affect the gut too. So what that means is like stress can affect what goes on in the tummy. Or like a mood.
Well, isn't that the whole thing as well about you feel butterflies in your stomach when you're nervous?
Yeah, exactly.
So, it's all it's all like kind of interrelated. So then what are your thoughts on probiotics?
Yeah, so it's just one more thing I should say as well about the microbiome. It does have a role like on the sex hormones as well.
Oh, yes.
I think that's an important one too, because like say even for a lot of like females who suffer with problems with the periods, like oftentimes the solution is not like a hormone replacement, whether it's OCP, synthetic bioidentical, but rather addressing that balance in the gut.
OCP being oral contraceptive pill.
Oral contraceptive pill, because we have some bacteria that are responsible for estrogen metabolism in particular. Now, there was some recent literature, I haven't followed up with it, so don't quote me, but that there potentially is a testosterone. So the group of bacteria responsible for estrogen metabolism are called the estrobolome, and the potentially is a testosterone. But like I said, don't quote me on that. I think that was in the early potential.
When you do a stool sample, do you test for the gut microbiome? Do you test for all those bacteria?
Oh yes, you're looking at all the commensals. Now, to be honest, like I don't think there's enough research really to support like some of the stuff that comes back, in the sense of like if you look at the report, they go through all of the various bacteria like of the commensals, and they say, okay, if this is high, it's associated with chronic fatigue, or it's associated with autoimmune or whatever. These are just like roughly based on the literature. Like, I'm not going to be going looking at them and saying, okay, that needs to, like, I'm going to use this techniques to fix this. Like, that's not, I don't think there's enough research to support that, or I don't think it's even remotely there. I suppose you're looking at the pharmacy's to bacteroides ratio. That's helpful. Or the pathogens. So like if there's a parasite, depends on what the parasite is. Like, some of them be more chronic, some of them don't cause any problems for some people, but for some people they cause vivid symptoms.
And when you're talking about parasite, are you talking about parasite that people would just pick up from being abroad, or from just daily life? Or so what is that parasite?
Oh, sorry. So like obviously it's not like the ones, and this is often where people get confused. They're like, oh God, I must have gotten something from India. Like,
so that's why I want you to explain.
Yeah, you're dead right. You're dead right. Thank you. So usually those parasites are actually better, because at least we get sick. So we know we've got some sort of bug. So we might vomit, we get diarrhea, we might have to go to the hospital for a drip. But these are not those types of parasites. These are more chronic ones, more insidious ones. So things like like blastocystis hominis, and like I said, there's many different types of blasto, and so those are tested as well. Like when we do the stool test, to do the micro and the PCR, so at least you see what type it is this likely to be contributing to symptoms. If it is, we can treat it. If not, there's no need to. I think most people, like, they'll be doing a stool test, have symptoms, like, so they do better without it, but it's not the easiest thing in the world to treat. Or diantomoeba fragilis is another. Those would be the two most common.
And are they naturally in the gut? They just have an overgrowth if someone has if someone is suffering from, like what you say, or is it that they're not in the gut in normal individuals?
Well, like, I suppose the literature would say that sometimes it's there and it doesn't cause symptoms. So like that's, I think diantomoeba, regardless, like it's worth treating that, because like that really is, like, for most people they do better without that being there. But like I said, some of the research will say with blasto that it can be there, doesn't cause any problems. But again, like, is that because they're not looking at the whole picture of what's going on in the gut? They're just doing parasitology tests. They're not looking at the other markers, like the secreted immunoglobulin A or all those inflammatory markers, or, as I said earlier, the metabolic imbalance markers. So the beta-glucuronidase, all of those things that are short-chain fatty acids, all these things we can test as well. So that's parasite, but it can also be like bacteria there that's not supposed to be, or in pathogenic range. And like I said, maybe it's there at a low level, it's fine, and then it reaches a certain point whereby it is causing problems. Like Citrobacter fruitei is a common one, especially if we look at the literature, potentially associated with IBS-like symptoms. Again, once that's treated, like, people do much better. Now, like I said, they're not just treating the pathogen. Like, they also have to, like, you have to get rid of the bad stuff and repopulate the good stuff and get everything else working. So it's not just microbial. There might be like an issue with the lining of the gut. So leaky gut is the term most people will be familiar with. And so is
that a thing, leaky gut?
I suppose the technical term is impaired intestinal permeability. So
yeah, because people, they go, leaky gut.
Yeah, no,
it's not really a thing. But like you've just said, the actual name for it.
Yeah, impaired intestinal permeability. So what it means is, I suppose, remember those junctions that normally tightly control what does or doesn't come in or out of the intestine. So if there's a vitamin or mineral sensor says, like, I usually use the air traffic control center. Now I hope I get this right now today. So let's say if we have the air traffic control center, normally they're there on all the planes, like they okay, it's okay to land now, here's a good time to land, on you go, and they say off you go now to the next plane. They're going out of the airport, outbound, and everything works nice and smooth and harmoniously. So what needs to go into the airport work is nice and smooth. What goes out is nice, strict timetable. Everything works well. What happens then if, like, the terrorists come into the air traffic control center? It's chaos. The airplanes out in the sky, they don't know when they can land or if they can land. The ones going out are crashing into the ones going in, and there's all this chaos ensuing from, like they said, the terrorists are equivalent, like, to, let's say, bad bacteria being in the gut and causing this disharmony ultimately. So I don't know, does that make sense to be?
Yeah, but, I think that's good. That's a good analogy.
So we don't know what should come in and come out, and ultimately the problem resides is when we get what's called lipopolysaccharide endotoxin in through that type barrier, and that causes chronic inflammation in low grade, potentially chronic low grade inflammation in the blood, which again that can affect, like, the brain as well, like, and that's often where you get the brain fog type symptoms. Like, the CRP isn't going to really be elevated in that circumstance usually. But once you employ, I suppose, some of those techniques to repair that barrier, the best one really is fixing the microbial issue that caused it in the first place, cleaning up the food, and
so how do you do that? That's what I want to know. How do you repopulate the gut with the bacteria that should be there? Yeah. What is clean food? Okay, yeah, and I suppose that it's a hard one to answer because it is going to be different for everyone by and large. Yeah, and I suppose, like, a therapeutic diet, like, is generally, like, elimination is usually best general approach. But I like to say to people that the diet is just allowing for a calm environment to address whatever has come back on the test. So, like, say some people, they don't need probiotics or prebiotics, and I suppose that came back maybe to your initial question in the sense of what do I think of probiotics. I think when used appropriately they can give incredible effects, but the problem is that people are taking them maybe willy-nilly in the sense of they don't, like, you sometimes cause more harm than good. So say, for example, I remember when I first took them, I hadn't done any testing, like, I was in bits. It was an absolute bits. Like, it's like, I'd be so curious about these things, like, because, I might have someone else saying, I took this probiotic and it was amazing. I think, try to give it a go. Like. Yeah. So I think the other thing that I would be conscious of as well is we know so much
like I would rarely really use probiotics, to be honest with you. More so prebiotics, for people, and try to get them to eat probiotic foods.
So explain the difference.
Oh, sorry. Prebiotic is like a food for the good bacteria. So
it's like fibre, really, isn't it?
Yeah. So there's different types. Like arabinogalactin is one that I would use quite a lot with people. Depends whether they can tolerate it or not. Like some people hate the taste of it. But look, these are other things hurdles you have to overcome. But the prebiotic is more like food for the bacteria. So it helps like to encourage the growth of the bacteria. And I suppose the reason I'm just conscious of probiotics is because like we know so much about what the microbiome does. And so if you don't if it ain't broken, don't fix it is usually the way I would say with the gut, because let's say you have a perfect gut, is where you go into the toilet every day, there's no bloating, you can tolerate a wide variety of foods, that's another key point, and you have no real health complaints as such. I wouldn't recommend just taking a probiotic prophylactically, because you like, there's still so much we don't know about the microbiome, and so you take this probiotic, what's in it, how much units it is being absorbed, like, or is it able to reside there? Is what does that do? And what if that has the opposite effect? So like a lot of people have overgrowth, like, they don't be needing any probiotics. So it depends.
And is overgrowth the same symptoms as undergrowth? So overgrowth of some will cause the symptoms that you're talking about, and then
Now this now look, the SIBO is slightly different, like, but from a microbiome in the lower part of the gut, like overgrowth often looks the same, to be honest, as like undergrowth. Sorry, my voice is going a little.
I know, we've been talking for ages.
Sorry. I just have water, I'll be fine.
So is there anything else that you'd like to say in terms of, the type of medicine that you practice, or the type of things that people need to watch out for their overall health? I'm
drawing a blank here now.
That's okay. We've gone through a lot.
Need to look out for. I think the important thing is if you do have symptoms, to get somebody who can help. And if you don't get help the first time, keep trying. Like, keep trying. Keep going, because
you didn't get help the first time, am I right?
I didn't get first, second, third, fourth, fifth. Like I said, this is 30 years later. I found somebody that understood me.
And it was only because you ended up in the treatment centre, is that right?
Yeah, I remember I had to go to the hospital first with the leg. So even when I went in there, I was admitted for a week, only because the therapist came in the A&E and was like, they're trying to get rid of me, like, genuinely.
Do they know that you cut yourself?
Yeah, obviously, that's what I was in for, was the suicide attempt. And the lady said, "Oh, do you feel comfortable going home now?" And I said, "No, I don't. Like, I still have glass in my foot, like, from where I walked."
Where did you cut yourself?
Oh, no, there's a full story. So, like, I did it twice on the same night, to be honest. The first time I did it, I decided, I actually don't, I could see the bone, like, and I just tourniquet up, and there's a table broken on the floor. I had to walk over to my briefcase because I knew I was going into shock. It's like, no, actually, this is not good. I need to sort this out. So I tourniquet up, pass out, and then other stuff happened in the house, and yeah, that was the second attempt. So I still have blood in my foot, like, from this walking across the glass on the floor. And she asked me, "Oh, do you feel safe going home?" And I said, "No." I was terrified, like, absolutely terrified of what I was going to do to myself on one hand, and still annoyed that it didn't work, and I'm here, and it was just terrific.
It's those mixed emotions, isn't it? It's like you're terrified and you're also pissed off you're not dead, but you also but there must have been some part of you that wanted to stay.
Of course. Like, I definitely, no, when I was there, I wanted.
Yeah.
Look, I said to her, I don't feel safe. Like, I was, like, when I was in the treatment centre, I didn't want to leave. Like, that was the safest I'd ever felt in my entire life. Like, that was
was the leg cut, and the fact that you ended up in hospital with that, was that maybe a cry for help rather than an actual serious attempt, or was it a serious attempt?
The time before the treatment centre, that was definitely, yeah, like I said, I only found by chance. Like, if I wasn't, wouldn't be here now. Like, so, like I said, there has to be something out there, like, that saved me somehow. Like, it's pure chance, basically. But like I said, I was in the hospital for the week with the leg and everything else. And I was discharged, like, not so much as a leaflet, like.
Were you in the psychiatric area?
Yeah, I was in a closed ward, like,
Okay, and then you were just by, see you? Any follow-up? Any, like, we'll send you?
Not so much as a...
See, it's very, that's...
Yeah,
That's very
I'm laughing
scary
about
to
it now.
think.
That's
Yeah.
terrible. Like, it's really terrible. But it's just, I'm laughing more in disbelief. Like, you know.
Well, yeah, I know that, but that's why I'm saying that isn't that terrible. And did you have anyone to go home to, Fionnula?
I didn't, but yeah, the person that came to get me, he was probably not the right person for me to be going to, because then when I remembered all the stuff it was around that person.
Okay.
But look, it was what it was at the time. At least there was somebody. Like, what would I have done if I had to go back to the same place that I was living in, like with himself? Like, definitely wouldn't still be here. Like, no denying that.
Okay.
So I suppose in terms of like advice to somebody else, just keep trying. Like, I mean, you have to have hope. Like, and that's something I didn't have for such a long time, is hope. Like, I remember my therapist saying to me, to that initially, like, she's like, you have to find, like, I literally had no hope. Like,
And do you have hope now?
I have my dog now, and she's my little like shining light and my
She's so
little angel.
cute, little Juno. I wouldn't let Carlo near her, he'd destroy her.
Who?
Carlo, my dog, he'd destroy her. He's a big boxer. He's great.
Oh no, she's well able to fend for herself now. Like, she might look very minuscule, but yeah, she's a toughie. Like,
Like her mom.
don't know about that. She just doesn't realise her size. Like, but no, she like, yeah, it's like I had to live for her, you know. So, like, that's the only reason I got through those first months. Like, yeah, I really had nothing and nobody. Like, was broke, you know.
Did you have friends though? Because you said that friends had come to get you.
Yeah, but you know, like, I suppose it's the same thing. There's nothing. I don't feel any like bad energy or resentment or anything towards them. But like, people have their own lives, you know what I mean? And
Yeah.
they have their own families and their own stuff going on at work. And like, people, they just, you know, she went to treatment centre, she's grand. And it's not like I was like, you know, on the phone, oh, I'm doing so bad. Like, no, like, but yeah.
Did you people checking in on you even?
No, not initially. Like, no,
Okay.
for a good many months.
Did you keep it to yourself though, or did people know that there was? Were you open about it back then?
I was,
Okay.
yeah. You know, people just weren't able to. Like I said, I don't have any like anger or like resentment. Like, but it's hard. If somebody can't, some people can't be around that. You know, they're just not.
I think it
able.
scares some people.
Yeah, it
and I think
is.
some people might see it like as, oh God, well, either, oh God, she's totally crazy,
Yeah.
or they don't want it in their face because it might
Yeah. Or
bring
what
back.
if they say something and then I think, yeah.
Yeah.
But look, it does at the time, like, that was tough, yeah.
But you're in a great place now.
Yeah, I'm so happy. Like, and look, that's not true. I'm just content in life.
Okay.
Like, and that's like, I think emotions are normal. So to feel happy at some point, to feel sad at some point, to feel anxious at some point, these things are all normal. Like, you know,
Yeah.
I think maybe that's missing too at the moment, whereas people feel anything like, oh God, I have anxiety disorder. Like, no, that's normal. Like, when
Yeah.
I come here to say I'm a little bit anxious, so like, you know, that's normal. I still come, I still, like, I'm able to do what I need to do. But
Were you anxious coming here today?
Oh yeah, a little bit.
I was a bit nervous
really?
myself. I always am
Oh.
before a podcast.
Yeah.
Because I always wanted to go well, and I always want my guest to feel comfortable and to
Okay.
get for them to feel that they got as much out of it as I did, rather than it
No, I
be.
do feel very comfortable. Thank you.
Oh, that's good. That's good, because I know that's really important to me. So I always feel really nervous, but I knew the minute you come into the house that it would be.
Yeah. Oh, that's good.
Yeah.
And likewise. But you know what? These things are normal. Like, you know, I've been public speaking since I'm very young, like doing
Yeah.
debating and all. So, and no matter how many times you do it, just to get a bit nervous before you do it. And I think
Yeah.
that's a good thing.
Yeah.
You know, I mean, if you didn't get a bit of nerves, you wouldn't have as much adrenaline. You probably wouldn't perform as well.
Yeah.
I think when I was younger, maybe, like, I remember when I used to compete in swimming, I'd be so nervous I'd get sick in the pool. That's different. Like, that is inhibiting like my ability to do it. But now, like I said, it doesn't mean I have anxiety disorder. I don't need to take a Xanax.
Yes.
That's problematic. But yeah, those emotions are normal, and like, I'm grateful that I can feel sad at times, like, that I can feel happy, that I can look at Junior and I feel love. Like, you know, I never had experienced like real love, like, until I had her. Like, that was my first. And there were times maybe that I was so unwell that I couldn't feel that. Like, you know, I knew I had to feed her, I knew I had to walk her, but I couldn't feel that way, and that is scary. Like, so, like I said, emotions are good. It's and I'm very grateful for that at the moment. Yeah,
That's
and
wonderful.
To be able to cry. Look, I mean, I used to be so afraid of crying, like thinking, "Oh God, what on earth is going to happen?" Now, you cry, you feel better afterwards.
100%. You always feel good when you let yourself out.
So no, it's good.
And are you? So you say you have hope, which is brilliant, and you're obviously like hopeful for the future. But are you ever at the back of your mind a little bit worried that you may feel down again, or do you feel that you have enough coping mechanisms in your life to recognise it if it does happen and then seek the help that you need? Or does that ever, like, you're such an intelligent lady, it obviously crosses your mind.
Of course it does. Like, and I said, I think you always have to be a little bit on high alert and look out for triggers and look out for any of these like warning signs. And like I said, that's why I still go to therapy. Like, I don't ever intend on not going to therapy anymore. Like, you know, like, it's just like, gosh, no, I can't even imagine not going, like, because it's been so helpful. But do I worry? Yeah, but I think I have a lot of things in place. And first and foremost, I have an awareness. Like, you know, at least I know, like, look, when it comes up to August Bank Holiday weekend every year, I know, okay, this is a time I'm not always great, so I'm going to do all these things to look after myself. Like, you know, I'm not going to, or Christmas, like, look, like I said, I'm still 5 years in now. Like, Christmas is still like, you know, I don't like it. I don't like, you know, there's such a prodrome now, like, you know, this decorations and all this sort of stuff is like, no.
Christmas starts literally from 31st of October, or no, 1st November, like once Halloween is done.
The shop is opening now in Bride Thomas, I heard.
Oh my goodness.
So it's like, it's not easy to escape, but every year there's emotions that come up. But every year, I suppose, like, even this time now, I'm thinking, okay, Christmas is coming up, but I'm not as like, oh God, like, this is going to be the worst time of my life. Like, how am I going to get through this now? I'm like, okay, I'm going to feel sad. I might remember things and it's not pleasant, but I do what I do every year. Me and Junior and I, to be correct, like, we have our little time together, go for a walk, we eat nice foods. I might go to the gym. That's my Christmas, like, and that's fine. It's one day and you get over it. You know, I think Christmas is a huge thing for people, but it's like I said, it's not like,
well, Christmas is huge, but I think commercially it's been made huge. Christmas is an incredibly sad time for many people.
Yeah, it is.
Or a real anticlimax for people too. Yeah. Like, just.
But remember, Christmas is a time, especially in Ireland, where like families are together. There's a lot of booze, and if somebody is drinking or does drugs, like, there's an excuse to do more of it. So in families, like, you know, the problems are going to arise, and bad stuff is inevitably going to happen when there's so much of that fuel to the fire, as it were. So, you know, I'm sure not the only one who doesn't particularly look forward to Christmas.
No, you're absolutely not.
But like I said, like, look, I'm lucky I have Junior. It'd be probably a very different situation if I didn't, like, you know, but
but it's wonderful that you have her, and that you recognise that you need her, and that the positive impact that an animal can have on someone's life and mental health, so important.
Yeah, but even this year now, she had 3 slip discs, and I had to like wheel her around in a buggy, like, you know, it's like I'm being serious, like, the leg was paralysed. And they were like, the vet told me, like, oh, like, you know, like, in a few weeks now, like, she won't be able to go to the toilet, you have to put her down. Like, sorry, what? It's like, my dog is only like 4 years old, 4.5. He's talking about putting her down. I'm like, are you serious? I'm so glad I found another orthopedic guy, and he helped out. Like, but like, that was the scary. Like, but, you know, especially with dogs, they do have a limited it's a timeline, and so you have to kind of
and also it can be very costly to go down the route of veterinary care when there is something seriously wrong with them, and sometimes the option is, you know, to put them down, and that obviously not in your mind frame at all.
I got insurance, thank God, because even the CT was like 1,500 or something.
It's like adult medicine, isn't it?
It's more than, like, how much is a CT for a human? Like, someone told me recently they got a CT maybe 200 quid or 150. I'm like, do you know how much Junior's was? Like €1,500.
Mad, isn't it?
Just thank God I got her insurance.
I know.
So, yeah.
Fionnula, it's been an absolute pleasure speaking to you. You're an amazing lady. And, you know, I think we meandered through a chat, but I think I really touched on all the topics that I wanted to speak with you about. But just before we end, I do always ask my guests 2 questions. So the first one is, what piece of advice would you give young people today? And the second is, what is the meaning of life? So,
so the first one is to be yourself and to figure out what that is. So regardless of what's expected of you, to try and figure out, what do you want, what do you like, what do you not like, and be okay with that. You know, whether it's, look, I mean, nowadays it's never been easier to be yourself, whether we're talking about like what sex you want to be, or, you know, how you want to dress, or how you want to wear your hair, whether you want to have tattoos or piercings, whatever it is. If you want to do it, like, you know, because I think if I look back and think of all the things that I would have done to please other people, or keep this person happy, or not say this and not behave this way, like, I mean, you know, it's not worth it, you know, because it's, you know, life is life and it's short. Like, at the end of the day, we're born and then we're going to die eventually. Like, there's no getting around that. So you may as well do what pleases you, because as I said before, no matter what you do, some people are going to like you and some people are going to hate you, and you can't please everybody. Like, it's simply not possible. So I think that's
lovely.
Yeah,
that's definitely something to go by, because there will always be the haters.
Like I said, I don't know that I have any real like right to be sitting here and giving people advice like on life. But like that, if I had a child, maybe that's what I would say to them. Like,
okay, and then what is the meaning of life?
Yeah, no, so I actually, when you told me this question, just to be very honest with people, I did have the tendency to go and look up on the internet. What do people say now about this? Like, or going to ask people, what do you think? So I was like, no, Fionnula, come on. What do you think? So I'm
be yourself. Listen to your first answer and
so
be yourself.
Like, not going to look. And I'm like, okay, if we look at it from a scientific perspective, right? So what happens? We are born like other species. We grow, we hunt, gather, we reproduce, and then we die, like, you know. So I actually don't think that this is, again, now bear with me. So I don't know that I would say there's a huge amount of meaning in life other than going through the various stages, but that we find a way ultimately to give life meaning. Like, and I've heard that quote ages ago. I can't remember who it was from, but it was along that lines anyways. But to make each day something that like it is real. Like, so what I realized is, like, even just a simple thing like being on the beach at sunrise, like with my dog, like it's just so much bliss. Like, okay, and life is that's life. Like, you know, that's the meaning for me, is with my dog and my work. Like, you know, that's meaningful to me, and that makes my life meaningful, that like I can do that, help people and make some sort of living from it. Like, or, you know, it's such a blessing for me to be able to train. Like, I mean, so I make that part of life, my life. Like, I love training. Like, might be hard. Sometimes I don't always want to go. Like, but you know, it's to put into each day something that's meaningful to you. Like, I think, and that's probably different from everyone, but whether there's a meaning to life on a philosophical level, I don't know, like, that there really is. I think the thing that makes us different as a species is our brain and how we interact, communicate with people and experience all these emotions. So I think the people that search for the meaning in life, they're searching for a meaning because there's something wrong and they're not okay in themselves, or they're looking for something to give them like, okay, this is why I'm here. But what if we just figure out, like, what do I want? What do I enjoy? And am I making something in each day? Because you don't know, is tomorrow going to come or not? Like, none of us know whether we're going to be here tomorrow or not. So
find meaning in every day.
Yeah, put meaning into life.
Lovely.
Rather than finding the meaning of life. That, like I said, that's just my perspective, and maybe that's like really like.
But that's why I ask you, because I want to know everyone's opinion, because I don't even know what my own is.
Yeah, you know, it's a hard question,
isn't it?
Like, I remember when you said it first, it's like, oh, that's grand, like I'll figure something out. And
yeah.
Like, over the days of trying to think, like, God, like, what is to me? Like,
I know,
because we're born and then we die, like, and at a
And that's the meaning.
scientific.
On a scientific level, that's the meaning.
But then people say, oh, the meaning maybe to reproduce. But what about for people who don't maybe want to have children? That's not maybe in their plan. Like, it doesn't mean their life has no meaning. Like, you know, and I think, you know, obviously as a woman who doesn't have kids, and I don't know will that ever happen. Like, but, you know, I still don't think, like, there's no meaning in my life. Like, first of all, my dog is my daughter. And that might sound very crazy to people, but hey, that's the least crazy thing you're going to hear out of me today. And so, like, but I think maybe I've interacted with people who are like, oh, like, what are you going to do with your life if you don't have kids? Like, well, there's so many other things.
There's so much more to life than having children.
It's just, I suppose, not having these preconceived notions either of how life should go. Like, oh, you should be married by this age and have the kids by that age, because what we see nowadays is sometimes things go to shit that doesn't work out. So, you know, putting this pressure on ourselves to achieve all these milestones or things that society expects of us, I think is problematic in itself. But anyways, come back to the meaning of life. Like, that's where I stand.
You put meaning into life. That's wonderful.
Yeah.
That's a lovely way to end. Thanks so much, Fionnula. It's been an absolute pleasure.
Thank you so much, Soraya. Loved this.
I've
chat
loved
today.
it. I've loved it.
Thanks
a million.
Thank you.